November is National Hospice and Palliative Care Month, so this afternoon we're talking about that care, and oftentimes people don't understand the difference between the two of them. Kathy and Lisa with us here from ProMedica to break things down. Okay, easy for you to understand and explain, but what is palliative care versus hospice care in simple terms?
Okay. So palliative medicine is a supportive service. We help patients and families while they're going through their treatments and therapies. We help with pain and symptom management and support. And hospice is more meant when you've used all of the aggressive treatments and therapies that are available and maybe they're just not working, or you just want to really focus on comfort and quality of life, or you're nearing end of life. That's when hospice care comes in. They're the experts at that.
Hospice care is family coming in, friends coming in, and spending the last few days with their loved one and just enjoying time together and making sure the loved one does enjoy the feeling of love from their friends and family, right?
Correct. In palliative services, we really advocate for our supportive care to come in as early as diagnosis when someone receives a cancer diagnosis. When they're in the hospital, it's traumatic, and not just to the patient, but for the whole family. So we ask to be consulted and brought in to help the whole family understand what's going on and bring together all the pieces of the puzzle so they can come up with really their goals of care and help understand what that prognosis looks like down the line.
So if you're the patient, I would imagine the mental part of it is very important too, to make sure they stay positive. If they have any chance of beating this disease, whatever their malady is, keeping them positive, laying the cards out on the table, letting them know what the future may be. It may be a bumpy ride, but a lot of cases, can you recover and then come out of palliative care, or is that the first step toward hospice care?
I think our greatest achievement would be to have a patient that graduates from palliative care, because we want to be along for the journey, essentially. And we are right there with the patient and the family, fighting with them to beat that cancer, beat that diagnosis, and to really step out of palliative care. So we would love to see that happen.
Kathy, how has what you do changed over the years? Has medicine changed how you do palliative care, or is it pretty much the standard thing? I would think some advances in medicine may help some people recover a little bit better than others.
Yes, that's absolutely true. We do see a lot of cancer patients, especially in our clinics. And if a patient goes into remission and they're doing better, then we can still be there to kind of help support them, even if they've recovered. But we don't have to be as stringent with the symptom management, because a lot of times their symptoms have improved once their diagnosis has gone into remission.
Now, during COVID, had to be a real difficult time for you guys, because you're still dealing with things that have to happen, or the end of life is happening, or severe illness, but yet you have the family part of it, and you hate for people to die alone. I mean, COVID was killing people alone in the hospital when we were still learning how to handle it. Once we got settled down through some of that, I know, because I had a friend who was passing away, and he was in hospice care, and we were able to go in there. We were able to spend time with him. How did things affect you guys differently than maybe a nursing home had to shut the doors pretty much?
Well, one of the things when we would get consulted, usually our big thing is to meet with the patients and the families to have these serious conversations and discussions about what's going on. But a lot of times the families could not come to the hospital, so we had to have those very difficult conversations over the phone. And I think that was the biggest challenge for our palliative medicine team. Well,
we're out of time, but Kathy and Lisa, thank you so much for what you do.
Thank
very
you.
important work, both palliative care and hospice care as well. Thanks so much.